Did you know that Medicare Advantage plans have a lock-in period, meaning that once you enroll, you are locked in for the remainder of the calendar year? Yes, it's true. You can only disenroll at certain times of the year, such as during the annual election period that occurs every year in the fall. However, you also get one chance in your lifetime to try a Medicare Advantage plan and be able to leave that plan to go back to original Medicare with no questions asked. This is called a trial right period. You might be asking, why would Medicare allow a trial right for Advantage plans? Well, for many years, Medicare beneficiaries have filled in the gaps in Medicare with a Medigap plan that pays after Medicare. And these plans have provided very predictable coverage with little out-of-pocket on the back end, depending on which plan you choose. And they also allow you freedom of access to select your own providers. There are no networks. And these Medigap plans have annual rate increases, just like most other types of insurance. So over the years, these premiums can add up, making beneficiaries want to explore the different types of Medicare plans. But they work differently. Medicare Advantage plans are private insurance plans that pay instead of Medicare. And yes, they usually do have lower monthly premiums than Medigap plans, but instead you're going to pay copays and coinsurance for health services as you go along. These plans also have networks of providers, and some plans will require you to choose a primary care doctor or get a referral if you need to see a specialist. They're often attractive with benefits such as dental coverage, transportation, gym memberships. Some of them even have a Part B giveback. Some beneficiaries unfortunately focus more on the additional perks than the really important benefits when they enroll, rather than making sure that their providers are in the network and the built-in drug coverage includes the medications they take. And they also don't often take the time to learn how the plan's network works or what the plan charges for certain healthcare services. So they may then find themselves stuck in a plan with network hassles or requirements for referrals or prior authorizations that they don't enjoy dealing with. Or perhaps they join a plan only to find that their doctor dropped out of the network mid-year and now they need to find a new provider. It doesn't matter the reason. If this is the first time you have been enrolled in a Medicare Advantage plan and you dislike it, you can leave that plan anytime in the first 12 months and return to original Medicare using a special election period called your trial right. You don't have to wait for the next valid election period to disenroll, and there are two scenarios where this might occur. The first is when you join a Medicare Advantage plan right out of the gate at 65, and then you decide to leave that plan in your first year. When you disenroll and return to original Medicare, you'll be given an opportunity to get a Medigap plan with no health underwriting. They cannot ask you health questions. So you can review all the Medigap plans you are eligible for in your area and choose any one you like. To qualify for this trial right, your Medicare Advantage plan must start on the same day as your Part A and Part B. The second scenario is when you have been on a Medicare plan with a Medigap plan, and then you decide to try a Medicare Advantage plan for the first time ever, meaning you've never been on any other Advantage plan before. You can use your trial right special election period to disenroll during that first year on that first Medicare Advantage plan, and you can return to the same Medigap plan that you had before with no health underwriting. This is a bit more limited because you can't apply to any Medigap plan in this scenario and expect that you get to skip the health questions. You could only return to your prior Medigap plan with your previous insurance company if you want to bypass the medical underwriting. Now, the trial right may sound great because most people want to save on Medicare premiums, and that's what makes them look at Advantage plans in the first place. The idea that you could try it for a year and still be able to get back to a Medigap plan without underwriting is pretty tempting. If there's one thing I want you to consider, though, it's this. If during that 1-year trial you are pretty healthy and you don't use many medical services, you're unlikely to encounter some of the things that make people sometimes dislike their Medicare Advantage plan. It's when you have health conditions that pop up or that require more frequent medical care that you may experience some things that sometimes people don't love about Medicare Advantage. Make sure that you know which medical services will be the most expensive for you if and when you encounter them on that plan. And do a little research. If you work with one of our Boomer Benefits agents, we can help you compare your options and see what will work most cost effectively for your healthcare needs. Remember also that if you have had a Medicare Advantage plan for longer than 12 months and you dislike it, you can still disenroll during another valid election period, like the annual election period or the Medicare Advantage open enrollment window. If you can't medically qualify to get a Medigap plan at that time, you can switch to a different Medicare Advantage plan, hopefully with benefits or a network that you like better. Be sure to watch our Medicare Advantage pros and cons video next to learn more about each type of coverage.